It's not an autoimmune disease. That's rheumatoid arthritis. This is not an autoimmune disease. It's just kind of wear and tear and joint breakdown. Hi, I'm Dr. Mona Morstein. Welcome to my channel. Today we're going to be talking about osteoarthritis. I've been in practice 36 years. If you're not a subscriber to my channel, please click below. Otherwise, here we go. So osteoarthritis is the most common joint disease. It affects more than 30 million people in the United States. That's a lot. It's the leading cause of disability in older adults. Now, osteoarthritis is considered a degenerative joint disorder with inflammation, and it happens when the joint hyaline cartilage breaks down. And so there's local tissue damage, there's inflammation, cartilage breakdown, and then progressive joint injury. So it's pretty common in the fingers, at the base of the thumb, in the knees, the hips, the shoulders. It's not that difficult to kind of start getting an idea if you have osteoarthritis. You've got deep and achy joint pain, stiffness, generally waking up a little stiff, or if you sit down for a while, you can get stiff. There's weakness in the hands in particular, but also lifting things. Can get limitation in movement, right? Because of what's happening in the joint. There can be swelling, like for example, I don't have them, my grandmother did, but you can get what's called little Heberden nodes, right? Which are overgrowths of bone that you can actually visualize through the finger tissue, right? Also, arthritis can be worse in wet weather changes. It's not an autoimmune disease. That's rheumatoid arthritis. This is not an autoimmune disease. It's just kind of wear and tear and joint breakdown. Now, we diagnose it generally from x-rays, and we'll see that in between joints where there should be some really good cartilage for shock absorption, there's really not. And the joints are really close together. And if they're really joint on joint, that's going to be the worst case scenario. There might be these bone spurs or osteophytes. That's another term for them. And those are bony growths that we see in the joints, or we can see it in the vertebrae, little pointy bits coming off the vertebrae on x-ray. And that can cause, that's showing damage to the bones, that's degenerating. Sometimes they do an MRI, but we don't really need that so much for osteoarthritis. But if we feel muscle or tendons are involved, or if we're thinking that there might need a surgical correction, they might do the MRI. So in conventional care, this is just considered a chronic, incurable disease, and try some hot, try some cold, try some physical therapy, try some occupational therapy, try some muscle strengthening. Now, that obviously does make sense if your knee has a little joint degeneration, and if we strengthen the thighs, the hamstrings, the muscles around it, so that the muscles can handle more of the stress of walking and not the joints, that's going to be a very beneficial thing. But the number one thing they put people on are what we call NSAIDs, non-steroidal anti-inflammatory drugs. And they'll do those topically, and they'll do those, of course, orally. So this is aspirin, this is ibuprofen, this is naproxen, and then there are other stronger ones that we can write a prescription for. Right? Now, NSAIDs are a huge problem as a drug. They're just a huge problem. Yeah, you can buy it, take them all the time, but they cause intestinal permeability. They cause leaky gut. They're indicated in recurrent diverticulitis. And we know they can cause a stomach ulcer. So these are a problem, but the worst problem is that NSAIDs can actually cause damage to the joint cartilage that we're taking it for to reduce the pain. So, really a catch-22. Oh, I have some joint degeneration and it hurts. Oh, I'm going to take some NSAID to settle the pain down, but it makes more joint degeneration, so I need more NSAIDs. What a really bad medical catch-22. Oh, you could take Tylenol, which is not an NSAID, it's just a pain reliever. But there is an inflammatory component to osteoarthritis that Tylenol won't be able to affect. I've had patients who had GERD, and I treated that, and they were fine. But then they were given even topical NSAID, and it caused their GERD. It started stirring that up because it got in their system. And of course, that's so bad for the stomach lining that it was actually irritating them topically. So we have to be careful of those. Now, another topical thing is called topical capsaicum. So this is cayenne pepper cream. So, and what it does is it kind of, the body sets up a pain gate where it just says, oh, I'm going to hurt. And it's just easy to keep going with this and stop it. And the capsaicin interferes with that and kind of resets the pain. But it is cayenne pepper. And if you don't touch your eyeball, don't touch down there. And when you go into the shower, it can burn a little bit. But over a few days, the burning in the joints may stop, but it's never going to stop if you touch your eyeball with capsaicin cream. So you have to be very careful with it. Of course, they also will do cortisone shots, which of course also breaks down tissue more. And also, are you pre-diabetic or diabetic? Guess what? Cortisone is going to raise your blood sugar. Completely contraindicated in that regard. Hyaluronic acid injections are given into joints like knee. They might do joint fusion. And of course, the end result is a joint replacement. Now, how does naturopathic medicine address osteoarthritis? Hey, if you've listened to me before, I'm going to sound like a broken record. But number one, dietary. Absolutely. You have got to avoid eating refined sugar if you have arthritis. That is the number one thing that causes it, and it's the number one thing that promotes it and worsens it. Sugar is the most pro-inflammatory thing that we can put in our mouth, and there is inflammation with osteoarthritis. When people, if they do nothing else in their diet but pull all refined sugar out for a month, I generally see 90 to 95% of people are 90% better with their arthritis getting rid of the refined sugar. Now, that's not fruit, and it's not even a date. It is what you know is refined sugar, cookie, cake, candy, etc. And even, guess what? I had one woman, a senior, she got rid of the sugar and her joints were feeling just so good. And then she called me up 3 or 4 months later. Oh, my joints are starting to hurt again. I said, did you get back into sugar? She's like, no, I didn't. But then we found out that she played bridge and people would come to her house and she had little bowls of candy on the tables for, I guess, the people to suck on as they're playing bridge. But she would have 1 or 2 pieces of a sugary sucking candy a day. And that was enough to have her arthritis pain start coming back, right? We don't need to eat a whole cheesecake for this. 1 or 2 pieces of candy, that'll do it. The other thing, we have to take out the sugar. We have to add in the omega-3. That is omega-3 oils. We've got to settle the inflammation down. This is the most anti-inflammatory oil, or one of the 2 most inflammatory ones. And you can eat that like oily fish. I had sardines for lunch. Love them. Very good with omega-3. You can have organic grass-fed, grass-finished meat or poultry. That'll have organic 3 in it. You can have organic 3 eggs where they fed the chickens flaxseed, and then their eggs have omega-3s in them. Leafy greens have omega-3. Walnuts have omega-3. Flax and chia seeds have omega-3. Organic soy has omega-3. So we can eat it, but we can also take it as capsules or liquids, as fish oils with high omega-3 oils, right? At least 1,000 milligrams of EPA a day and maybe 500 of DHA. That'll settle things down. And then, of course, just tidying up the diet, getting the junk food, the fast food, and maybe eating a little more vegetarian, especially if you're not going to eat 100% organic meat all the time. There are ideas that nightshades, which are tomatoes, potatoes, eggplant, and tobacco, can affect some people with arthritis. I don't see that as much as I see the refined sugar, But if you want to experiment with that and it seems to give you some benefit, that's fantastic. Also, sometimes a food sensitivity test will do. We'll also look at weight loss, just because, especially with knees and hips, that if there's a little extra weight, that's a little more pressure on the knees and hip that can lead to degeneration. And then the other supplements, well, I'm going to put everybody on a good multiple vitamin mineral. I'm going to put everybody on omega-3 oils. Another good kind of oil is called, this weird name, pro-resolving mediators, which are very anti-inflammatory. And even one capsule a day can make a difference. Of course, we have glucosamine sulfate, which is 1,500 milligrams a day, can be helpful. It's not going to help if you're just eating cakes and cookie and ice cream all the time, but if you're not, it can be. Another one is called chondroitin sulfate. Hey, that's a very big molecule, and you're not going to absorb it. So don't even waste your money on it if you don't get low molecular chondroitin sulfate. You can absorb that, and that's fine. But regular chondroitin sulfate, it ain't going to be absorbed. Also, MSM, methyl sulfonylmethane, can be very anti-inflammatory. Curcumin, turmeric, very anti-inflammatory. Bromelain, ginger. How about collagen? Collagen's numbers 2 and 4 are for the joints. 1 and 3, hair, skin, and nails. So you want collagen 2 and 4, and that can help with the joint tissue. A botanical called cat's claw can be very specific. Cat's claw is anti-inflammatory, but also a devil's claw. Devil's claw is very specific for the joints. And people sometimes get help with acupuncture. And also there's a machine you can get called an ultrasound, a home ultrasound unit called the Pro 2000 ultrasound. There's a company, TensPro, TENSPROS.com, TensPro, maybe not an S, TensPro.com. They sell this. Having a home ultrasound unit is very soothing for joints and muscles. Get a little older, you need to use some gel and do it for like 8 minutes, but it can really loosen up joints and muscles that are sore. So this is how we're looking with osteoarthritis, a very common, potentially debilitating condition that can really be reversed in many people before it's bone on bone. So I'm Dr. Mona Morstein. Make sure you subscribe to my channel. If you'd like to set up an appointment, click on my bio below and it'll take you there. And I look forward to seeing you again.